This system is no longer controlled by the doctor and the patient. And what the doctor says, and with consultation with the patient, what the standard of care should be from their medical groups, whether it's for us ENT or internal medicine, that doesn't have any power anymore. It's the insurance companies driving the delivery of healthcare and the choices, unfortunately, that the doctors can make. It's not right.
You're listening to Kerry Lutz's Financial Survival Network, where you get valuable information you just can't find anywhere else. To thrive in today's trying times, you need the Financial Survival Network, now more than ever. Go to financialsurvivalnetwork.com and get your free newsletter and gift. Financial Survival Network, now more than ever.
And welcome. You are listening to the Financial Survival Network. I'm your host, Kerry Lutz. Well, make America healthy again? Will RFK Jr. get the confirmation to Secretary of HHS? And will he be able to make a difference? Why does medicine cost so much? Why is everything so corrupt? If you've been watching Elon Musk rip the federal budget to shreds and perhaps rejoicing at the prospect of the tyranny of the purse actually being exposed, then you're going to want to hear this show. With us is the esteemed Dr. Elena George. We've been talking for years, Dr. George, you and I. And, well, what do you think of RFK? Do you think he can bring some sanity to this insane system?
I think that anything that exposes the underbelly and how the machine works is a positive. I think it's one of the most opaque parts of our economy, and it's huge. And at this point, it's just gotten more bloated, but it doesn't serve the interests of the doctor or the patient at this point.
So just for big pharma, we got this thing called prescription benefit managers, and they set the price for everything and everywhere. And one of them is owned by CVS, if I'm not mistaken, Caremark. And I don't remember, there's 2 or 3 of them. And they get a piece of every transaction that takes place. And who died and made them king is what I'd like to know, Dr. George.
I think the axiom, follow the money, is what you really have to keep your mind on. There's so much conflict of interest written into the system, it's amazing. So if the insurance companies are able to work with the pharmacy benefit management companies and they have a preferred pharmacy to go to, that actually limits the way for the patient to shop and save money because they are actually setting the price. But not only do they set the price, they change the formulary. So as a doctor, if I want to write a prescription that I know works, and the patient has this insurance plan, they will not pay for that medication. The patient is out of luck, or I have to change what I know to be, from what I know to be the best treatment to something that I'm not happy with. This system is no longer controlled by the doctor and the patient. And what the doctor says, and with consultation with the patient, what the standard of care should be from their medical groups, whether it's for us ENT or internal medicine, that doesn't have any power anymore. It's the insurance companies driving the delivery of healthcare and the choices, unfortunately, that the doctors can make. It's not right.
Right. And so what about hospitals? They're like taking over the practice. All the doctors are working for them now. Very few doctors, it seems, are left to be able to work for themselves. How did that happen?
It was a slow and steady slide. I had the benefit of being in this, in medical school and in residency during all these changes. So I saw it coming. At the beginning of my training, when people had insurance plans, they didn't cover the first dollar of healthcare. They only covered big ticket items, like if you had to have an expensive lab or if you had to have surgery. Otherwise, the patient was paying out of pocket directly to the doctor. And when the insurance companies took over the pocketbook or the purse, then they got to control everything. And people don't think about this, but they have a conflict of interest by definition as an entity that's about making money. Their job is to give value to their stockholders, right? So they want you to pay a premium, but they don't really want to pay out the cost of what your doctor wants or what you need. And it's become completely mercenary. So you have horrible stories that people have heard about where cancer treatment is denied because it's, quote, experimental. I can tell you from day to day, because I see patients every day, that we're always caught out. Even if we get a pre-authorization, it doesn't mean they're going to pay for the procedure or the office visit. And so it's a very one-sided system. It's a you win, I win, you lose, I win kind of system. Does it make sense to you as a layperson if you come to my office, I need to do a procedure on you, I ask your insurance if it's okay. It's called a pre-authorization because I have all the medical reasoning behind it. They say, yes, I do the procedure, and then they deny it after the fact, after they approved it. And I don't have any grounds to fight for it because I'm contracted to follow whatever they say. That goes on every day throughout the country. And at this point, that's one of the reasons that doctors have left private practice. It's one of the reasons they left practice altogether. And now we have a situation where we don't have enough doctors to take care of patients. And now we have a whole influx of other healthcare providers, whether they be nurse practitioners, physician assistants, aides, all of these things. And I don't mean just medicine. It's gone through pharmacy, every single aspect of our healthcare system, because its system is not designed to actually do what it's supposed to do, which is to help people. It's about making money. And there's no recourse. It's just really sad that the doctors and patients are the victims in this. And of course, it's so opaque. You can't say this as a doctor because the patient can't necessarily see it, but they're thinking that you're the problem, when in actuality, it's these big entities and this infrastructure that's enormous.
It seems like they don't really want to cure diseases anymore. They just want to treat them, and then you become a lifelong customer of the drug company.
It's a business model, isn't it? It makes perfect sense if you have a customer for life on more than one medication daily, and you're managing the disease and you're never really curing it. So, I would love to see if we do get a change over at HHS, a change from treating a disease to preventing the disease. It seems that we have all these treatments for after the fact, but if we can change things that make people sick, whether that be what's in the water, what chemicals are in various things that we're exposed to, would that cut down on the reason, or the disease itself, the amount of people who get it? That would save the ultimate amount of money, as opposed to trying to find the disease and then have some algorithm to treat it forever. It doesn't seem like it doesn't really make a lot of sense if you think about cost and human cost and quality of life cost. This is a no-brainer.
And let's not forget that we didn't have this epidemic of chronic diseases 40, 50, 60 years ago. We didn't have obesity to the level we have it now. It was relatively unusual to see an obese person. And now it's really gone rampant.
Well, think about the food industry. We had cane sugar back in the day. Now we have high fructose corn syrup. We have other chemicals that make our estrogen levels go up or affect our blood pressure. All these things are children where I think the number one disease may be now obesity or diabetes. It's going through the roof in younger and younger kids. But no one seems to be looking at what's the common denominator, what's in the food, where they're all eating, what additives are put in that weren't there 50 years ago, and get rid of them. This is not really hard if you just take a look at it and try to be on the side of the patient instead of getting back in, whatever position you're in, getting it reelected. It's all people care about is the money coming in to get them back in, come hell or high water. That's the problem.
Yeah. So RFK Jr. is talking about seed oils, which we know are inflammatory agents, fatty omega-6s that cause inflammation in the body. healthy eating, whole foods, all these things. So many of the so-called food products that are sold in the United States aren't allowed in Europe, not even in Canada, our next door neighbor. He gave the example of Fruit Loops had 18 ingredients, and the ones in Canada did as well. But the difference was that none of the ingredients in the Canadian Fruit Loops were artificial. They were all natural. And breakfast cereal's like the worst thing in the world. It's pure sugar, pure poison.
And chemicals. And it's expensive too. So for those who keep saying that, if we make these changes, it's going to be cost prohibitive, $5 or $6 for, a box of cereal is cost prohibitive, and it's full of toxins. I'm sure people do. I think there's a growing number of people who are making healthy choices. And I love to see that side of our food industry and our healthcare system work in tandem. Doctors have a lot of power. I don't think we spend enough time as a group talking about health to our patients. It's about what drug can we give them, as opposed to how do we get you off of the medication, right?
Yeah,
and that's a mindset change.
Yeah. And the whole chronic illnesses, they just didn't exist. And then when we studied primitive cultures out there, right, and they don't have any of these diseases until until they get modernized, right? And they adopt the Western or American diet.
That's true. I mean, our diet has got a lot to be desired, frankly. And if we can have an honest conversation, and everybody's voice should be heard. I don't think it should be one way. And I don't subscribe to censorship. If you don't like something, it doesn't mean you just shut it down. You have to, how about cite your source? How about have a discussion and come to a conclusion that everybody can live with, as opposed to my way or no way? And maybe this is a good atmosphere now to open up the conversation to thinking a different way. I just don't think doing the same thing and expecting a different result is working, because the cost of the healthcare system for an individual to get into it is prohibitive. Nobody's looking at that. But the best thing is I tell my patients, don't get sick, right? This is how you work the system. Don't enter it, because you're not sure what's going to happen when you're in it. And I practice what I preach on this one. And, ultimately, Kerry, it's about choice, individual choices. I think we need to want better for ourselves as individuals. So if people want to take a pill because it's a fast track to losing weight or to growing hair or whatever they're doing, but not think about any of the adverse effects, and you hear them on TV, I swear the list is getting longer and longer. The cutesy commercial, if you just, slow down and not listen to the music, but listen to the words, it's amazing. And anything that causes death as one of its side effects, I personally would be having really second, third, and fourth thoughts about taking that seriously.
Yeah, well, but on the other hand, the weight loss pills, the GLP-1s, GLP-2s, Ozempic and Mounjaro, they enable people to take off these pounds, and it's easier to lose the weight. It's easier to keep the weight off than it is to lose it. So just that obesity itself is so unhealthy that maybe it's worth taking some of these weight loss drugs.
But they all have side effects to them, and potentially you'd have to be on them for the rest of your life. I don't have a problem with something if it's short term as a bridge to give you means to, but that's not really what's going on. It's a lot of for the rest of your life kind of thing. Yeah, and you're losing muscle, not just fat, when you're losing weight, and you're not eating, so your vitamin status and your nutrition goes down. So there's a lot of things. We need to have a sense of balance. Throwing everybody on it and having kids go on it without changing the reason that they're exactly. So, it's just going to go down to infants needing it at some point. They don't have an off switch with this. As soon as that door is open, they find someone who's going to be able to use it.
So, Dr. George, just switching up a little bit here. When Elon Musk breaks into the HHS computers, the Medicaid, the Medicare computers, what shocks are in store for us there?
Gee, that's a great question. I can only speak about it from the doctor side of it. And those are two of our healthcare delivery systems that I don't partake in because they don't serve the patient. So I don't know, but I know that I would think that from the pharmacy side, they definitely have a protocol of what medicines that they allow. And the reason I love Medicaid was I couldn't prescribe medicines that worked for my patient because they were never on formulary. So I wonder how much the pharmacy benefit management company is involved with that side of the healthcare system because the government's involved. So they're going to want to get the lowest denominator in terms of cost savings as they can get. But I wonder where that money's going to. So I don't know. I can't answer that, but I wouldn't be surprised if we find some real whoppers in there.
You got to realize that from that system, there's way more money coming out than from USAID or even the Defense Department. I think Health and Human Services is putting out more than defense, like $1.7 billion. So it's going to be shocking. I'm just telling you, it's going to be prepared to be shocked.
I would bet that most of the money is going to medication and not to services like doctors and, physical therapists and PT and, that sort of thing, chronic care. I bet you most is going to medicine. I wouldn't be surprised if it wasn't.
Yeah. Yeah. Well, if there's only half the upheaval like there is in the foreign aid sector, we're in for quite a show, aren't we?
I think we are. And hopefully it'll clean out the whatever disease is in there so we can start over.
Mm-hmm. All right. So 3 things you can do to improve your health right now.
Number 1 is clean up your water intake, right? So there was a lot of things about filtering your water and about bottled water versus tap water. We're 70% water. What we drink does matter. So I would recommend people, if they can afford it, to invest in a home system, reverse osmosis that takes impurities out. I would stay away from plastics because microplastics are one of the main problems. Is one of those forever type of things that once it ends up in your system, we can't get it out. And we don't know what that's going to cause down the road. So investing in systems, using glass bottles. I personally think things like putting hydrogen or getting a hydrogen system for your water, or definitely not drinking tap would be number 1. The second thing is to try to eat as organic as you possibly can, as we already know that there's so many chemicals in the system itself, in the food distribution system, in the supply, that if you can clean it out, what you're putting in with organic, where they're not getting eating food that's genetically modified or anything that's, all these vaccines are being put into the food industry on the cattle, et cetera. I try to clean that out as well and shop local. So there are plenty of co-ops in every city, every state that you can actually join, and you can work with farmers locally and get food that's much cheaper, better quality, and consistent. So you're not going to have to be at the mercy of something going down in the commercial shopping sector. What happened with the different Krogers and Publix, et cetera, when they go down for whatever reason, the supply chain is affected. So that would be number 2. And 3, it sounds kind of out there, but I would have a relationship with God, to be honest, because there's so much, I don't know, you can't trust anything that people say, right? Human beings are notoriously everywhere. But if you have a relationship with a higher power, someone bigger than yourself, I think that gives you stability. I think that makes you less likely to be at the whim and emotionally, the ebb and flow of what goes on emotionally. Because fear is what gets people into trouble. And when you're fearful, you fall for anything. And I think we as human beings need to be much more mindful of that.
Mm-hmm. Yep. I couldn't agree with you more. And so it starts with attitude, and
yes.
Your attitude affects your behavior. And from there, once your behavior changes, everything else changes too, right?
Absolutely. But you're in a position of power, right? So you're not waiting for something to come down the pipe that you have to react to. You're prepared. You have a plan. Whatever goes down, you can fall back on that, knowing that I've prepared. I've got what I need. I know the direction that I want to go to, and more importantly, the direction that I don't want to go to, because that's where I think people get into trouble. I want to follow the group. I think, someone's there to help me and they care about me. That is the worst position to be in. You will be, set up for God knows what. So don't do that.
Yes. I couldn't agree with you more on that, Dr. George. And so water, attitude, relationship with God, and then find the healthy food. It's out there. It's not just at Whole Foods. It's in a lot of other places. A lot of the foods at Whole Foods are what I call fake health foods, right? They're not real. They're not really healthy. If something's swimming in sugar and seed oil, I don't care if it's on the first aisle at the Whole Foods. I don't want it.
I think you're absolutely right. I mean, the thing that people don't realize is that if you go local, if you have a relationship with farmers, people who produce, then you have a pathway around every single thing that can happen in the bigger picture, the bigger system. It doesn't affect you the same way at all.
Exactly. All right. Hey, we appreciate, as always, you coming on, sharing your knowledge and wisdom with us, Dr. George. How do we find you? How do we find your podcast? And how do we connect with you on the web?
Well, you can go to libertytalk.fm, and that's where I have Living in the Solution. It's a podcast that runs live on Saturdays and Sundays at noon Eastern Time. You can also go to my website, drelenageorge.com, and I have podcasts that have been going on for many, many years, and links that help people do what I recommend. Everybody has to have a skin in this game. And the more knowledge you have, the more power you have. I'm all about that. And I think everything has a solution, and we are our own solution, not looking for somebody else to do it for us.
All right, Dr. George, appreciate that. And the links are in the show notes to this interview on financialsurvivalnetwork.com. We ask if you go there, just sign up for a free complimentary newsletter, as over 70,000 FSN community members have in the past. And if you got a question for myself, Dr. George, KL@kerrylutz.com is the email address. Dr. George, we always appreciate you taking time out to talk with us, and we wish you the best.
Thank you, Kerry. God bless.
Thanks for listening to Kerry Lutz's Financial Survival Network, your solution to today's trying times. For the latest, go to financialsurvivalnetwork.com. Financial Survival Network, now more than ever.